Good afternoon. My name is Adran Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It is our COVID-19 briefing today, which is April the 29th. Over the next number of days, there'll be a briefing tomorrow at 3 o'clock here in the Press Theatre. Dr. Henry, on Friday, we will be doing a statement with an update on important events on Friday at 3 o'clock with an update on cases. Dr. Henry will be giving a briefing here Saturday at noon. And then on Monday, we'll be giving a briefing that will include some updating of modeling at 1:30 on Monday afternoon. And so with that, and acknowledging that we're on the traditional territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations, I'd like to have the honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For our update today, we have 34 new test positive cases here in British Columbia, bringing our total number of people who have tested positive to 2,087 in British Columbia. That includes 811 people in the Vancouver Coastal Health Region, 941 in the Fraser Health Region, 120 people in the Vancouver Island Health Authority region, 169 in Interior Health Region, and 46 people up in the north. We have 24 active long-term care or acute care or assisted living facility outbreaks right now. So that's a two additional ones where we have a single person who has been who has tested positive, and an outbreak response is ongoing. One of those is in Clayton Heights, and the other is Langley Lodge in Fraser Health. Langley Lodge did have an outbreak earlier on a few weeks ago that was declared over, but a new case has been identified, so they are back into ensuring that they have all of the outbreak precautions in place. Overall, in long-term care assisted living or in the acute care, the 3 acute care units, we have 252 residents who are affected and 152 staff. There are 13 outbreaks that are now declared over, including one of the outbreaks in Interior Health, the Kootenay Street Village, which has had no cases for the last 2 incubation periods. We continue to have ongoing testing and investigations at our community outbreaks, and we are now up to 50 people who have tested positive at Superior Poultry and 42 people at the United Poultry work site. And we know that, again, the investigations are ongoing, both in those 2 areas and also in a number of other workplace where there is potential for transmission and cases have been identified, and we know that those investigations are ongoing as well. There's no change in the number of people who have tested positive at the Federal Correctional Facility in Mission, the Mission Medium Correctional Facility. We remain at 120, including 108 inmates and 12 staff. We also, at this point, have 89 people who are hospitalized, and of those, 35 are in critical care or ICU. Unfortunately, we have an additional 4 deaths to report today, bringing the total number of people who've died from COVID-19 to 109 in British Columbia. And all 4 of the people who passed away in the last day were seniors and elders from long-term care homes in our outbreaks. And again, you know, every time we think of the people who have been affected by this, and our heart goes out to their families, to their caregivers in their communities who will miss them. Yesterday, I reported on a death in Interior Health, and just a little bit more detail. And that person was a man in his 70s who had been in hospital for some time and had acquired his COVID-19 whilst traveling outside of Canada a number of weeks ago. We now have 1,305 people, and I've checked those numbers today, who have fully recovered from COVID-19 in British Columbia. We've spoken extensively over the last many days and weeks about our testing strategy, and I just wanted to reiterate that we are changing and modifying as we do based on the circumstances that we have here in British Columbia, and our testing strategy will continue to evolve. Right now, as we've talked about, testing is available to anybody in our community who has symptoms of COVID-19, including even very mild symptoms, and is also being used quite extensively, as we've talked about, for identification and investigation of clusters, because we recognize that sometimes, particularly in some of the workplace clusters that we've been looking at and at the federal prison and our long-term care outbreaks, that people can have very mild illness or may have unrecognized illness or may have reasons why they are reluctant to reveal that they're feeling unwell or they have some mild illness, and it could be related to concerns about employment and concerns about passing it on to others. So we have taken an approach of having very broad testing in those types of environments to make sure that we catch everybody, even people who might have very mild or no symptoms at all. It's very important for us to understand, however, that random testing in the community of anybody with no symptoms is of very little value to us with the current tests that we have. In fact, that type of testing leads to both false positives and false negatives. And for a variety of reasons, it's not a reliable mechanism to understand what's happening in our communities when it's used that way. The best things and the most important things we need to continue to do in our communities, all of us now, is to continue to clean our hands regularly, to not touch our face, to cover our cough and sneezes, to ensure we're keeping our safe physical distance, and to have a very, very sensitive threshold for staying home and staying away from others if we're not feeling well. It's important for us to understand as well where testing can help us, and I've talked about some of the outbreaks, and just to talk about some of the outbreaks that we've had in the past where this has been really important. You will recall early on in our pandemic here in British Columbia, we had a number of cases who were related to a dental conference that was being held in Vancouver, and just to give people an update, we now have a total of 87 people who were associated with that conference here in British Columbia, and I know there are additional people in other provinces and around the world who had attended that event, and we know that there was at least one, but probably several people who had COVID-19, most of them probably not recognizing it during the time they were at that event, and it was spread. And as of course we're all aware, here in British Columbia we had one death in a dentist associated with that conference. The other thing that we are doing that is really important for our next strategy, our next phase, is making sure that we're monitoring everybody that's coming into British Columbia from outside the country. And that includes the measures that we put in place to enhance the federal measures at our borders for people who are returning to British Columbia. And we've assessed over 15,000 people who have returned to British Columbia. These are Canadians who have returned home. Often they had been away for often many years. And over 15,000 since we started this on April 10th. We reviewed and helped people detail over 4,000 self-isolation plans. Most people's were fine of those 15,000, but some of them needed assistance, and over 350 people needed additional support to be able to implement their isolation plans. In addition, we've had almost 100 people who we have provided accommodation to and supported to be able to enact their self-isolation plans to protect both themselves and their families and our communities here in BC. And I really want to tip my hat and thank all of the public servants and our public health professionals who supported people in being able to do that, and the measures at the border. In addition, we have put in additional supports for our temporary foreign workers who've come into British Columbia to support our essential work on farms and across the province. And of the over 900 temporary foreign workers who've come in over the last few weeks, We've provided them with both medical support, social supports, and accommodation to be able to effectively quarantine. Some of those people have finished their quarantine and are now going to our farms across the province to support the agriculture, the necessary support that we need. I will note that out of the 900 and some people who we have monitored in this way, we have had 4 people from 4 different flights of temporary foreign workers who've come into the province who've tested positive for COVID-19. So it just speaks to us of how important it is to keep up these measures, to support people, to make sure that they can do what we need them to do, and to be able to identify people who have symptoms, get them tested, and be able to support them medically as well through getting over their COVID-19 if that arises. So today, the Premier shared that the framework for our BC New Normal approach will be provided to you next week. We've highlighted that we are being thoughtful and careful and purposeful in our planning. And on Monday, we'll be providing our latest modeling and some more details, plus some more details around the epidemiology about who has been affected and where and how here in British Columbia. This is our path forward, and we are looking forward to being able to share that information with you. As we're all well aware, this virus is challenging us every day. The public health measures that we have in place, the illness the virus causes, and the loss of life are hard on all of us. The orders and the restrictions that we have in place now have worked, and they've worked because we have followed them collectively, and we have done our bit to protect our families and our communities. And I need and will continue to thank you all for doing the right thing. You have demonstrated the creativity, the compassion, and the care that we needed to get us through that part of our pandemic. And we need to continue this. We need to continue to work together, to continue to make a difference, and to continue to support each other through this next phase. We are not alone in this, either in BC, in Canada, or around the world. All of us globally have been affected by this pandemic, and we in BC have been shaken by this storm. But we have shown that we can work together and that our foundation remains strong. And we need to continue this with our mantra of being kind and being calm and staying safe.
Thank you very much, Dr. Henry, and I just wanted to join Dr. Henry and on behalf of the Premier and the government, I think the people of BC, to send our condolences to the 4 families of the 4 people who've passed away in the last 24 hours from COVID-19. They and 105 other cases of people who've passed away have suffered a terrible loss in the midst of this difficult pandemic, and we think of them in all 4 cases, 3 of them in Vancouver Coastal Health and 1 in Fraser Health. They were elders and they were in care, but they also in every way represent a huge loss for their community, for their family, and a huge loss to those who were taking care of them. So we're thinking of them today with all our hearts and wishing all our best to their families in what is a difficult time to grieve, but one where we grieve, hopefully, together. As Dr. Henry has said, we have 34 additional cases today. We have 89 people who are in hospital in British Columbia as a result of COVID-19. And well, that number is down. It's 46 in Fraser Health, 6 in Interior Health, 5 on Vancouver Island, 3 in Northern Health, and 29 in Vancouver Coastal Health. 89 is, of course, down from where it was on April 6th, which was 149 cases. There are also fewer people. I think we're down to 35 people in critical care, and we wanted to acknowledge again the extraordinary work by the teams in critical care, from healthcare workers, nurses to doctors, who are working together to provide supports for people with outcomes that have been given the very serious circumstances when people enter critical care, have been very good, and we acknowledge their work and celebrate and recognize their work. There are 4,117 beds that are empty in BC. That means we're operating today at about 63.1% capacity, or 63% capacity, 45.7% capacity in critical care. So in other words, we have and we continue to withstand the cases that have come to us with respect to COVID-19. I also note that we had approximately 4,300 emergency room visits yesterday, and that, while down from the totals, is consistent with what we had with the last number of days, where people are using emergency room services over the last number of days, much more than they had in the early part of April. I wanted to report out on surgical cases and those that have been completed in the period, first of all, from March 16th to April 26th. We've completed 14,597 cases across the 5 regional health authorities and the Provincial Health Services Authority. 8,767 of those were urgent scheduled surgeries, which have continued. 5,830 were unscheduled or emergent or emergency surgeries that were required within a 24 to 48 hour period, just to give you a sense of the work that continues to be done in healthcare. We also have a breakdown of postponed cases. That's 16,101. Should be recognized that this somewhat understates the number of cases that would have taken place otherwise, since cases tend to be scheduled 3 weeks in advance. And so now we understand that there obviously would have been cases, for example, scheduled this week that had not been postponed but would have happened. We would expect by the 3rd week in May that it will be between 28,000 and 30,000 surgeries that would have occurred and that did not occur because of the cancellation of elective surgeries. And so I just wanted to say a couple of other things. Obviously, the Premier spoke out today about his plans and our plans as a government in the coming weeks. He addressed BC's renewal and said that in order to open up the economy more than we are now, we need to have a plan, and we need full buy-in from British Columbians. He acknowledged the relative success we've had in flattening the curve, acknowledging also the profound impact COVID-19 has had on all British Columbians. In the days and weeks ahead, as the Premier announces the plan for renewal, and as we all work to implement it, our success will rest on what has got us to that point, and it is what will carry us forward. And that's holding to our 100% commitment to follow the rules and the guidelines Dr. Henry sets out, even as they change somewhat, and adapt to allow us to open up society and the economy to renew BC. Staying 100% all in the weeks and months ahead will build on the success we've achieved and will continue to show what we can accomplish safely and confidently when we're in this all together. All together for the ones we love, all together for the ones we don't know, all together for the ones that we will meet in the future. Aujourd'hui, nous annonçons 34 nouveaux cas pour un total de 2087 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 4 nouveaux décès liés au COVID-19, 3 à Vancouver Coastal et 1 à Fraser, pour un total de 109 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Chaque région de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 811 se trouvent à Vancouver Coastal, 941 à Fraser, 120 sur l'île de Vancouver, 169 dans l'intérieur et 46 au nord. Parmi l'ensemble de cas confirmés de COVID-19, 89 personnes sont actuellement hospitalisées, dont 35 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup, and we're happy to take your questions.